patient is scheduled for a telehealth visit. Which of the following conditions is not appropriate for a telehealth or a virtual visit? So we are looking for which choice is incorrect. So let's review reasons that would be appropriate for a telehealth visit. So overall, you want to do something that doesn't require much testing. Testing, not much. Because if you're meeting with the patient virtually, you can't necessarily order tests or do blood work or do anything that would require them to physically be present for you to provide that care. You also want to make sure that it's something that's not emergent, because if it's very severe or something that's a true emergency, they should be going to the emergency department by ambulance. They shouldn't be going on a telehealth visit. So these are some overall ideas of what could be considered okay for a telehealth visit. So let's look at the choices so we can put this into practice. So option A states routine follow-up for hypertension. So some key terms here: routine. Routine is usually good. Routine, you're thinking not too severe most of the time. So that's something that looks like a good thing for telehealth. And it's a follow-up for hypertension. And yeah, that would be a great example of something that would be a good telehealth visit. Your routine, you're following up. You're mostly just having a conversation about how the patient's been doing with managing their blood pressure. And there's not really much physical that's involved for the provider to need you to physically be in person for a visit like this. So because the question is asking which is not appropriate for a telehealth visit, we will eliminate that because option A would be a good option for a telehealth visit. Option B states initial consultation for a rash. And yes, even though you might think, oh, initial consultation, you're meeting for the first time, I'm not sure. But no, this actually would be okay to do for a telehealth visit. A rash is something that you could put up to the camera to show the provider so they could see it in the virtual space. And then the provider could ask questions so they could get a better idea of what it physically is like, this rash for you. And there's not really much of a need to physically be in person for something like this. So this could be a good example of a telehealth visit. And the question is asking which is not, so we will eliminate option B. Option C states severe chest pain. So this should raise some flags. If you see severe, and over here, we're stating that a telehealth visit has to be something not emergent. And this is an emergency. It sounds like this person could be potentially having a heart attack, especially since it's so severe. They should be going to the emergency room. They should not be going on a telehealth visit. But this question is asking which is not an appropriate choice. So option C is definitely not an appropriate choice. So we can select this as our answer. But let's take a look at option D just to review that as well. And option D states medication review, and this would just be a conversation between the patient and the provider. There's not a need for them to be physically in the space for something like that, so we could eliminate that because the question is asking which is not an appropriate choice.